Etonogestrel is a long-acting synthetic derived progestin contraceptive used in various devices such as contraceptive rings and intradermal implants. In this video, let's find found. What is etonogestrel? What is etonogestrel used for? Contraindication. What are the side effects of taking etonogestrel? How does etonogestrel work? How to use etonogestrel? What is etonogestrel? Etonogestrel is a medication which is used as a means of birth control for women. It is available as an implant placed under the skin of the upper arm under the brand names Nexplanon and Implanon. Etonogestrel was patented in 1972 and introduced for medical use in 1998. It became available in the United States in 2006. Etonogestrel implants are approved in more than 90 countries and used by about 3 million women globally as of 2010. What is etonogestrel used for? Etonogestrel is administered in subdermal implants as long-acting reversible contraception. It is known to be effective in postpartum insertion, including breastfeeding women. Etonogestrel is part of the long-acting contraceptive implants that prevent pregnancy. The implant's effect can remain for 5 years. Contraindication. Women should not use implants if they are, or think they are, pregnant, are allergic to etonogestrel, have vaginal bleeding that has not been explained, have some forms of severe liver disease. Women should not use combined hormonal contraceptives, CHC, if they have migraines with auras. Side effects: nausea, stomach cramping/bloating, dizziness, headache, breast tenderness, acne, hair loss, weight gain, and vaginal irritation/discharge may occur. Pain, bruising, numbness, infection, and scarring may occur at the site where the rod is placed. Pharmacodynamic. Etonogestrel attains its therapeutic effect inhibiting fertility by impairing the release of the luteinizing hormone, which is one of the most important reproductive hormones for ovulation. As well, etonogestrel is known to increase the viscosity of the cervical mucus, hindering the passage of the spermatozoa entering the lining in the uterus to prevent the implantation of the fertilized eggs in the endometrium. In clinical trials, etonogestrel was implanted and reported to avoid 100% of pregnancies over a 3-year period. When the implant was removed, normal periods were reinstalled within 90 days in 91% of the individuals. Fertility was established quickly, with 20 reported pregnancies within 3 months of implant removal. The implants of etonogestrel release 40 micrograms of etonogestrel daily, and they usually provide a continuous contraception effect for 3 years. When the implant is administered, the failure rate is reported to be 0.1%. Some non-contraceptive effects are improved dysmenorrhea. Mechanism of action. Etonogestrel binds with high affinity to the progesterone and estrogen receptors in the target organs. From the target organs, they include the female reproductive tract, mammary gland, hypothalamus, and pituitary. Once bound, this drug changes the synthesis of different proteins, which in order decreases the level of gonadotropin-releasing hormone and the luteinizing hormone. Half-life. The elimination half-life of etonogestrel is reported to be of 25 hours, which indicates a reversible contraceptive effect. Dose. Contraception. Insert 1 implant subdermally. No preceding hormonal contraceptive use in past month. Insert between days 1 through 5. Switch from combination other contraceptive. OCP within 7 days after last active pill. Vaginal ring during 7-day ring-free period etonogestrel/ethinylestradiol. Transdermal patch during 7-day patch-free period of a transdermal contraceptive system. Switch from progestin-only contraceptive. Any day of the month when switching from pill, do not skip any days between pill and insertion. On the same day as contraceptive implant removal. On the same day as removal of a progestin-containing IUD. On the day when next contraceptive injection would be due. Safety advice. AUTGA pregnancy category B3, drugs, which have been taken by only a limited number of pregnant women and women of childbearing age, without an increase in the frequency of malformation or other direct or indirect harmful effects on the human fetus having been observed. That's all the information about etonogestrel we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.